Hi everyone, welcome to day 2 of week 4. If you remember from the day 1 video, we did discuss chapter 3, which talked about your law and ethics and HIPAA. Today what we're going to focus on is going to be chapter 14, which talks about electronic health records and meaningful use. Now, as a medical assistant, or an upcoming medical assistant, it is really important that you understand what an electronic health record is, why it's important, and how we use them. Electronic health records are a computerized version of the patient's medical history, and this actually what it does is it takes the place of that paper chart that you are used to seeing. Electronic health records provide, again, that computerized means of gathering the information, documenting and storing that information about the patient and the care that they receive while they are in the facility. Electronic health records also allow patients' information to be used and seen by multiple physicians in hospitals, and this happens through a network of communication, but also a network of transferring of care. Now, electronic health records is more commonly and generally known by its acronym, EHR. But it wasn't always called an EHR. In fact, when computers first came into the medical facilities, we used this system and we used to call them computer-based medical records. So what that meant is we took the paper chart, we would scan the paper into the computer, but we would still use the paper chart. Not very effective. After the computers gained a lot of popularity and the software and technology got better, it was transformed into electronic medical records, or EMR. And that term used to work for quite a while, but now it's more than just a medical record. It's a full health record. It's a health history. So we transformed that term from EMR to EHR. And it was this term was first adopted and used by the Institute of Medicine of the National Academies, the IMO, and this happened in 2003. But what's really important to know is that EHRs have been around since the 1960s. In fact, Mayo Clinic first started using them, and ambulatory care clinics, like what you all will be working in, were a little reluctant to actually jump on that bandwagon and start using them. Now, the whole purpose of the EHR is really to strive to make healthcare safer and allow for better communication between the team members. In 2009, the first law got passed saying that funding would be available for those who wanted to use EHR and actually have that system implemented. HITECH was a part of that law, and HITECH stands for the Health Information Technology for Economic and Clinical Health Act. So that act got put into this law. And what the purpose of HITECH is it included financial incentives for providers who adopted and used EHR to demonstrate the effectiveness of quality of care, the improved safety, and the effectiveness of how their care got taken. Along with HITECH and the law that got put in place came a term that we so widely use now. That term is meaningful use. Meaningful use refers to a set of criteria for how EHRs are used and how the providers must meet those in order to receive that incentive program. Now you might be asking, what criteria could a law make that is needed? Well, in order to receive the incentives and the incentive payments, you had to be able to improve the quality, the safety, and the efficiency of patient care. They also had to engage patients and their family members in the patient's care itself. It needed to improve care coordination. It needed to improve not only public, but population health as well. And it needed to ensure privacy and security for personal health information. So it had to make sure it still used HIPAA. So at this point, you're probably wondering, well, what is the benefit to using an EHR? Why not just stay with the paper chart? Well, one of the key benefits that EHR brings is that it can be created, managed, and consulted by the authorized providers or the authorized staff across multiple different healthcare organizations. Think about this. OSF is one of the biggest health informations out there. They merged with Mayo Clinic and Mercy. So if you went to a Mayo Clinic, they wouldn't have to receive your records from OSF. They would have access to that. Really nice thing is that your doctor can know your entire health record, not just why you're there that day. Some of the other benefits are that it improves diagnostic and patient outcomes. By doing this, it helps to improve the ability to diagnose diseases and reduce or even prevent medical errors. It improves documentation. And the nice thing about this is that now documentation could take place in the examination room by the providers, instead of them having to recall that visit and try to document it at the end of the day. By documenting at the time of the actual event, it helped them to improve the patient's care and to keep the patient on board with their health. It also allows providers and medical assistants and nurses and all other healthcare teams to document more quickly, more consistently, and in more detail. It helps to improve care coordination because better coordination can lead to better quality of care, which leads to improved health outcomes for patients. And the biggest piece, I think, is that it actually leads to avoiding medical errors. So the nice thing is that EHRs actually set up alerts that go off for providers. It allows them to know if there's a possible medication error, if there's a possible interaction, maybe an allergy, if a patient's due for some routine procedures. For example, yearly pap smears, yearly mammograms, yearly physicals, injections, maybe you're due for a flu shot or a Hep B shot. The nice thing is that EMR actually keeps track of all of that and can alert the provider when you do come into the office, or even if you don't come into the office. It sends out a list of who is due for what and when. It also helps to decrease the problems with not being able to read provider handwriting, so medication errors are less likely to happen because we can read everything now. Alright guys, that is a good wrap-up of Chapter 14 for you. As always, you know I'm going to tell you to read your chapter in full, but I hope that I was able to help answer a couple of questions and get some of that confusion out for you. I look forward to seeing you all on Day 2. Bring any questions or concerns that you have for me, and have a wonderful day, guys. Bye-bye.